Okay. I'd like to call the meeting to order. This evening, Representative Shea is excused. So tonight we have myself, Elaine Daly, Stephanie DeVito, and Tom Winslow present. We're going to start right away with our departments and our committee updates. I'd like to start with Denise from 911. She's ready. Come on up.
Good evening. I'm gonna be quick.
Yep.
So I have a couple of resolutions that are, one is the Motorola resolution for the maintenance. That's JP2. And the first one is for Eaton. That's just a 4-month one to get us through the rest of this year for the UPS.
You want to move both of those and then we can discuss them?
Yeah, let's make a motion to put them both on the table as a bundle.
I'll second that.
Okay, go ahead.
I just have one question about JP1. Says Eaton Corporation submitted a maintenance contract for this equipment, which is end of life as of the end of this year.
Yeah.
What happens at the end of this
So we're
year?
gonna replace that UPS and we're already in the planning works of that. I've been working with Amanda on that and the new gentleman from Buildings and Grounds to replace that UPS, but the bigger issue is we don't know where the backup center is gonna be, so we can't go out to bid for it until we have a location for it.
So you budgeted for the replacement or of this, right? I mean,
So good, yes,
but you can't put an RFP out until,
do we know where the backup center is gonna go?
so what happens if you don't know by the end of the year?
Oh, we have to know by the end of the year.
Okay,
We
I
have
mean,
to have a decision.
because between the RFP process and getting something new
Yep.
is how long a period?
So the RFP process could just be 30 to 60 days, and that may not be that long of a period. But getting the actual equipment is gonna take time, but if we kind of have a plan in place, we should be fine. But we definitely need to know within the next probably 90 days what we're doing.
But after the end of the year, this particular vendor is done?
So they'll maintain it, but
Okay.
it's not, can't put it under contract any longer.
Oh, okay, so they'd still be providing the
They'll provide
service,
time and
Yes.
materials, but they can't put it under
but
contract.
they won't commit to another
That's
contract?
correct.
Okay, all right, well, that's at least better than nothing.
Yeah.
Yes. Mhm,
And it's not used frequently, obviously, because it's the backup center.
mhm.
It doesn't lose power often, so.
Yep. Okay, but they'd maintain what they have until,
We replace it.
yes,
Yeah.
okay.
Yeah.
Any other questions on either JP1 or JP2? Any questions from any other legislators? All in favor of JP1 and JP2?
Aye.
Any opposition? So carried. Thank you, Denise.
The only other thing I'll just update you on is, with respect to staff, we got our list, there were only 5 candidates on the list. You should have my report by now, it was late because I was on vacation. There were only 2 candidates that were interested right now. So we're gonna interview the 2 of them next week, and then I did have a lengthy conversation with HR today. Next month I'll put a resolution through for the help positions to try to get some people off the street because we're just not getting the candidates taking the test at this point.
Right,
So,
and it would potentially qualify that
We got
as a help.
yeah, so I already had those, was it considered certified through the Civil Service Commission last
Uh-huh.
year?
Yep.
So I think Diane overlooked that because the resolution was actually gonna come through this month.
Yeah, I thought you were gonna have it.
So I think she kind of overlooked that, which it's okay. We'll get through it. So we'll interview these 2. There are 2 more people on the list that I didn't get yet because they were lower. So they're gonna send those to me so we can kind of see if those people are interested. But then the help resolution will come through next month.
When are you looking for the class still as starting?
I can't until we even have 2 people that we know are interested, and then they gotta go through the whole background. We're looking at probably November at this point.
Okay. And is that something that is held here in county or you send them out of town for it?
No, we do it here in town.
Right here at our 911 center.
Yeah, so the big one, that's gonna pose a little bit of an issue too, because we use our backup center for all the practical training. So not having that is gonna put another hinder on our processes.
And are we able to coordinate, can we potentially coordinate with another county and use their backup center as a training spot or something? Or is that something we look?
You'd have to have the same phone, radio, and CAD to train.
So it'd have to be identical systems and there's no other identical systems in the region?
No, the closest is Oswego. And we may have to look at doing something like that for our training.
Yeah, Oswego County or Owego?
Oswego.
Oh, that's just one county
Yeah,
away.
yeah.
That's in the
So we
region.
may have to look into that. And
Yeah,
I'll talk to Kevin.
Yeah, I think that'd be a good idea. Okay, thank you.
Yeah.
If the positions go help or the resolution goes forward,
Yep.
are you compelled to use the current eligible list that you have before you revert to that?
So potentially we'll have exhausted it. So we can go ahead and just do the positions.
Exhausted it if you offered and they said no?
Correct.
Because you have to make an offer from that list and they
Yeah.
have to accept or
Yep.
say no.
Yep.
But and in your mind, having it a help position minus the test will be great for recruitment?
I don't know. It's hard to say. Cortland and Oswego both said they've had great luck with it. So part of the issue that I think is happening now is that we gave the test in January. We're 8 months down the road asking people if they want a job. And the other,
Because the list just got certified.
yeah, we just got it in June.
Mhm.
So, and then I just got the positions approved, so I couldn't even get the list until that point. The other issue is, I don't know, they're just not taking the test
Mhm.
like they used to be. I mean, when I started, we would get a list of 100 candidates.
Mhm.
It was never an issue. And now we're getting, I think 20, I think it's not the stats out, like 24 people signed up. 14 of them didn't show up.
Mhm.
And then I think only 9 ended up making it through the whole process.
But quitting a job for a test, if there's no eligibles list, quitting a job provisionally is very difficult.
Yeah, so this way they wouldn't even, they'd still be provisional for 12
Right.
12 months. They
Probationary.
wouldn't actually take the test.
Right.
I'm hoping it'll help, but until we try, I really, it's hard to say.
Is that, since we're discussing it at committee, is that something that would be prepared potentially in time for Ways and Means to be presented there?
I mean, the resolution's already prepared. Diane just didn't want to put it through because she didn't realize that they were already been certified. So we
Would
can
any,
certainly look at
would
that.
any committee member on JPS have an objection if we presented it at Ways and Means next month or this month?
Well, but that's what I was asking her.
Right.
Is she compelled to use that certified list?
So the thing is that will help us. It's still going to be, I mean, you're going to end up with
I
almost
have no
a
idea.
year of a gap of these positions that are going to go, the money will go back into the general fund. But, it's a benefit to us trying to get some more candidates but then we still have to, they have to go on Indeed and, post the position. So then you got to wait for,
So it would be helpful to move it
it
forward.
would absolutely help. Yeah. And the resolution's done. So it just
So-
didn't make it because we had to have this conversation.
So get me the resolution through Amanda, prior to Ways and Means, and I'll present it at Ways and Means.
Sure. Thank you.
All right, thank you very much.
Appreciate it.
Welcome. Sorry. District Attorney, Anthony, yeah.
Good afternoon. I have a few updates. We just had a jury trial conviction for assault in the second degree. That was for an assault on correctional officers at the Auburn Correctional Facility. We also are getting reimbursed by the state for approximately $43,000 for our work on correctional facility cases. That would get us up to speed, up to date to, I think, up to 2016. Our office fell off kind of seeking that reimbursement back in 2015, 16, so we hadn't sought it in a while. We went back, we're up to date up to about through 2016, and we're gonna keep going. So they just approved that $43,000 coming to our office. So, or going to the county rather, for the work that was done on that. I do have 2 resolutions. JP3 is authorization to amend my salary. I apologize for getting this resolution on late. It did take effect back in April. I just became aware of it in June, the end of June at the district attorney's conference.
And do you want to discuss JP4 real quick and then we'll present as a bundle?
JP4 is just seeking authorization to accept the grant funding for the victim services, our victim witness coordinator.
All right, can I get a motion for JP3 and JP4 as a bundle?
So
Second.
All right, JP3 is state mandated. That's not in our control. The state accept as the cost. Is that retroactive to January?
Till April 1st.
April 1st? Okay, the fiscal year for the state. And JP4 is just accepting grant money. So any questions on any of the
I
resolutions?
just have one question. Obviously, the additional $20,000 that you need that's coming out of contingency, you don't have it in your salary line or you would have moved it?
I would have moved it. I didn't know about it. Otherwise I would have.
But you don't have vacancies at this point. That's why there's not $20,000 in salary sitting there
Correct.
like there used to be when.
Like there used to be.
Yes, okay. And I'm just curious on JP4, why is there all this reference to these past grants?
Via the third whereas.
It almost sounds like you have to renew the job, or I'm just kind of confused.
I'm not sure why that was put in there. I didn't draft this myself, so I don't know. But basically this position is contingent on that funding, so I'm not sure if that's why that was put in there to show that.
So this position is continuing. This is what the resolution does, is allowed you to continue to hire the full-time and support, you have the money still to do it.
Yes.
Okay, I was just confused.
Yeah, it probably could be taken out. I'm not sure why it was left put in there, but it's just that funding, that grant money is the salary for
Okay.
that particular employee.
Any other further questions or comments? Any other legislators? All in favor?
Aye.
Any opposed? So moved.
Thank you so much.
Thank you. Mr. Hopkins, I saw you in the crowd here somewhere. Right here. Hi, Lloyd.
Good afternoon. You received my report, a written report. I just have just a couple updates for the office, if there aren't any questions on the report. We did, last month, we received two checks. The treasurer's office did $160,000 for aid to defense, which was unanticipated. And we received the same amount, another $160,000 for discovery reform. We can use the aid to defense money, the discovery reform money. I'm having a meeting with our 18B panel attorneys to see what their needs are in terms of spending that money on discoveries. It's dedicated for discovery. So we've got to come up with a budget, but I'll be presenting this next month by resolution to accept that money if we have a plan in place. The aid to defense money is just a grant that we got that we didn't anticipate it, but I'll also bring a resolution to authorize the acceptance of that. It was electronically sent to us, and the City Council administrators are still scrambling on, why we got this money. It's through DCJS. It isn't through Indigent Legal Services, so it came from a different state agency, but it's in the treasurer's office.
How much is it, Lloyd? Did you say?
$160,000 for the aid to defense,
Oh, aid to,
and the same amount for discovery.
Yeah,
So-
320.
but you have to use it for discovery, and aid to defense is more flexible.
Correct, yes. The only other issue I have, and Shireen and Steve and I have been meeting on this, and Shireen and Steve, just so you know, today they came and measured, apparently because of the addition of the third judge, they need office space for that third judge. And apparently Judge Boodleman's staff is moving down into my office, unbeknownst to us. And the new judge will take over Judge Boodleman's office. So I know you have your space crunched now. You can just add this one onto it, I guess.
Did they give you a time frame of when they're throwing you out?
No,
Okay. Let me know when they do.
I think it'll be,
January.
in the next,
Oh,
well, they take office by January, so I think the move will be by November.
Okay. Thank you, Lloyd. We'll find you someplace other than a closet.
Thank you.
Yeah. Any questions?
easy for you to say.
Well, right. I mean, I probably fit in a closet, so, hey,
Thank you.
no, thank you. Hey, I kept the expectations low, right?
That's
The
right,
closet. I mean, I
closet,
promised
that's
too
A
much.
drawer.
So that's right. Sheriff Skank, good afternoon. Good.
I don't have anything beyond my report, but I did want to mention We've been really taking a close look with Cayuga Counseling at our reentry program in the jail with the BPA funding that we received 3 years ago. We've got some real encouraging data, I believe, that I'd like to share with this committee next month. If everybody's okay with it, I'd like to invite her to just give a quick presentation regarding our reentry program.
Absolutely.
One of the things that we've shaken out from that program, we've served 218 individuals that are in the jail and being released. And 52% of them are homeless when they're released from the jail. So, we all know the challenges we have with the homeless population in our community. And I had some brief conversations with some of the other department heads, but I would really like to spearhead coming together and start talking about some of these challenges in a multidisciplinary way that we're dealing with, especially with the homelessness issue. It impacts many of our departments, it overlaps. And it's certainly an issue that I have with our sheriff's office that has necessitated me to ask for some resources as of late. So I would love to start talking about that, maybe get a member or two of this committee involved with some of those conversations. But as we're looking at our budget challenges and moving forward, I really think it's imperative that we look at, why this problem keeps growing, how it's impacting our budget. And is there anything that we can do? Maybe there's some low-hanging fruit or some things that we can look at, initially to try to address some of these things in a multidisciplinary way and just kind of try to look at how this is going to impact us moving forward. Because I'm really concerned as we're looking at our budget, we're potentially, considering cuts within the county. How is that going to impact, our problem moving forward? That's just going to continue to grow. So I would like to reach out again to some of the department heads that are impacted by this, along with some members of this committee, and hopefully have some conversations and see, if we can be proactive and try to address this, because, it can be reactive and throw money at it down the road, but, is there something we can do to try to, stop some of the bleeding here and address this issue? Because even with a homeless shelter, we're going to continue to have issues with this problem. And I think that there are some things that we can do if we work together on it. So that's the only thing I wanted to bring tonight. I can certainly answer any questions relative to my report, and I just have the one resolution.
I just had a question, Chair. Is there anything that you're still obligated to do in terms of that executive order, or I don't even know what it was, when you did that, when you started that community committee, and that's pretty much wrapped up?
The community collaborative, yes.
Yes.
So we should be reviewing that periodically. That is something that we should be doing. But as far as all of the deliverables with that initiative, we have delivered on those.
Okay.
But we should be taking a look at that again. It's really just encouraging community input moving forward to make sure that we're providing, services in a manner that the community expects from us.
Okay. Anybody else? Anyone else? All right. Thank you, Sheriff. Oh, we got to vote on it. That's right. I'm sorry. JP 10, I get a motion to put that on the table.
I'll move it.
Second. All right. JP 10 is accepting grant money, or I'm sorry, it allows the county to enter a negotiation. It signed the contract with the state for the budget of $757,000 for next year. This is a resolution that is for it's a resolution that allows a 5-year term, and then you sign it every year. Is that correct? Did I understand that correctly?
That's correct. The chair and I would sign that each year for 5 years before we came back with another resolution.
All right. Any other questions? All right. All in favor?
Aye.
Aye. Opposed? So moved. Thank you, Sheriff,
Thank you.
for that. I almost forgot about JP. All right. Riley.
All right, good evening, everyone. You have my report in front of you. I had no resolutions this evening. All I will update you with is just so everybody in the room is aware, we're looking at getting some weather coming in the next couple of days. Tail end remnants of Hurricane Debbie are going to be hitting. And we're looking in the 1.5 to 3 inch margin of potential for flash flooding on Friday. But as of right now, National Weather Service Bloomington is kind of edging off of the back down to the 70s as of 3 o'clock. So beyond weather updates and trying to be Wayne Mahar of Cayuga County, and my report in front of you. Are there any questions? Right.
Thank you.
I'm not bringing that up.
All right, Tyrone, you're up.
I'll just play the roller rather than
No.
my report. We were able to get get some of the best orders, thanks to, Lynn and Shereen after meeting with them. We were able to find some funds to get at least 4 of the best that we had. Other than that, anybody have any questions on any of my reports?
They just helped you find the funding, Tyrone, in the budget?
So we got those ordered, last week.
Oh, great.
Yeah, big shout out to you and Lynn for finding the funds and getting that done. What I'd like to do, Tyrone, is I'd like to bundle JP5, JP8, and JP9. If I get a motion to bundle JP5, 8, and 9 for presentation.
I made that.
Second. All right, and now if you wouldn't mind talking about 5, 8, and 9, and we'll move them along.
Basically, the alternative sentence, and our, pretrial kind of go with, Cayuga counseling. And, they've evidently been doing this for years, covering our community service parts and doing pretrial, services for us. So, we'd just like to continue that. I think if we had to do that in-house, it would require us to hire a bunch more people.
And there's a committee and a plan and all of this is included, right? I mean, that's,
We
yep.
have the ATI board, we started meeting, I think we've had 1 meeting and we have 1 coming up in September.
Yep. You want to go over 8?
Yeah, let's move on to 8,
Oh,
please.
sorry.
That's okay.
And then the GIVE grant is, we participated with the DA's office and we've offered PD. The only thing is, obviously the money decreased a little bit from the year before, just due to numbers and what we could justify.
So currently the GIVE grant, it's down to $80,000. And my understanding from our conversation is that we'll actually reimburse 50% of the position instead of, what was it, 100 before?
100%.
100% before. So we're gonna have to, that'll be a budgetary issue as well. Okay.
Correct.
So just so the committee's aware.
Transparent. So the give
Yep.
money last year was like 102.
It was like 100 and something.
Yeah.
And now it's
100,000.
80 because these are the eligible expenses that can go against the give grant. Okay.
And
They just gave you the 80 because that's all of the amount you could legitimately claim. Is it?
I would say that it would probably be in our best interest to do this as opposed to getting audited and.
Yes, I get it. Yep.
if any of the members would like, I have the breakdown of the 80,000 and how it's spent. If you'd like to see it. And JP9, Tyrone? Did we talk about that one? Authorizing the probation department to enter into contract for you counseling to provide partial release services. And that grant is the same amount as last year.
Yes, so the Cayuga counseling, the ATI, the alternate sentence and pretrial, it's all one number. So
Okay.
the 108,000, I think it is that we pay Cayuga counseling.
All right.
So, and they cover both.
Any further questions regarding 5, 8, or 9? Any members from the legislature on the floor? All in favor?
Aye.
All right, so moved. Let's talk about JP6 first.
So that's principal typist. We have a retirement coming up at the end of the month. Our principal typist basically does our purchasing, trades restitution, enters restitution. Really kind of the day-to-day operation. So without that position, it would make it pretty difficult.
So it's just upon retirement, replacing a current staff position due to retirement. Any other questions?
You don't have very many clerical positions within the department?
You have four clerical positions. So the principal typist that does that part, we have two senior typists. One does our supervision caseload, and the other does investigations, and then the account clerk who does the tracking of restitution.
Any other questions? Any other questions from anyone else? All right. All in favor?
Aye.
Aye. Any opposed? All right, so carried. And JP, that was this JP7, next one.
It's, probation supervisor. This is also due to retirement. So we'll be losing a supervisor in September.
And it's my understanding, Tyrone, this is a state, the state requires you have one supervisor per every 4 to 7 officers. It's okay.
So, again, without that, once again, that'd be pretty tough to operate. Because that would mean that I would probably have to supervise the overflow.
Any other questions? Or any questions? All right, all in favor? Aye. Any opposed? Okay, so moved. Thank you, Tyrone.
Thank you.
All right. I think that covers it. All right. I can get a motion to adjourn our meeting.
Jonathan?
You approved the minutes. Oh, yes, I never approved the meetings. That was right at the top. So I got a motion to approve the July 8th, 2024 minutes.
So move.
All right, all in favor?
Aye.
Now can I get a motion to adjourn?
So move.
All right, we're adjourned. Thank you for the reminder. I skipped over the line.
That's 4:45.
I was gonna reach out to you, stenographer stay? She's sticking around.
Staying for now is what she tells me. So I will take what I can get. So she's changed her schedule from 5 days a week to 4 days a week. She's doing that.
Hard to manage how you want.
I'm hoping that'll make her more money than what she is making if she goes there and stay.
So roll call, we have an excused absence from legislator Mark Strong. Legislators Jonna Anathan are here, Stephanie DeVito here, Hans Petra here, myself here. Minutes to approve for our July 8th, 2004 meeting. A motion?
Make a motion?
Second.
Any discussion? All in favor?
Aye.
Any opposed? Carries. I'm going to move around department updates a little bit. I'm first going to go all the way down to Deborah Dennis, who does not have any resolutions. And find out if you have updates other than, okay.
Good evening. Updates so far that I have going on, just working on reimbursements for the programs that we have. A lot for the year that we work off with reimbursements that ends September 30th. So a lot of people are getting their program expenses in. Still doing site visits, but they're wrapping up because most of the programs are summer programs that end in the next week or so. And after doing those site visits, I do an evaluation, and then the directors of those programs, the state requires like a self-evaluation too. So that's always nice to kind of see where they can improve and where they might need some assistance. A request for applications for 2025 just went out this week. I've sent them out to all previous applicants as well as other contacts I have. I'd be happy to share that with everybody as well. If you know of anybody who may be interested in applying for funding for any youth programs, please feel free to put them in touch with me and I'd be happy to get them the appropriate paperwork. We have a deadline for that. I'd like everything back to me by October 1st so our committee can meet and make those determinations in the month of October where the funding would go for the next program year, which starts October 1st of 2024 and ends September 30th of 2025. Some programs that are going on right now, the summer rec programs and some of the Little League programs. I know that 5 different AEDs have been purchased that are getting reimbursed for the different Little Leagues we have throughout the county. The YMCA did free swim lessons this summer at Casey Park, and they've actually been able to do swim lessons for 52 children for free. One new program we have this year is Combat Recovery. They have an event this Saturday. It's a combat bully workshop, and they're going to be doing those throughout the county starting this month. They have a speaker, they're doing t-shirts, and they're promoting a lot of their youth programs in the area, and that's for ages 6 to 12. So that's just some of the highlights that have been going on with the programs that we fund here in Cayuga County, if anybody has any questions.
When do your requests for funding for 2025 begin?
Right, I just sent the request out this
request?
week, so I'd like to get them back October 1st.
October
Just
1st?
so that the group can get together and we can meet and make those determinations so we can get the resolutions in sooner this year than we did last year, because there's been a shift and we went away from the calendar year from when I had first began a couple of years ago, and now we're on that state system where everything is kind of shifted back, so we're trying to get everything allocated earlier than we have in the past.
And Deborah, you have like 3 different funding.
Yep, so I have youth development fund, and I'll bring a resolution next for September to actually accept the funding from New York State. We have youth development funding. We have the youth team sports again, which that was always, last year was the first year we received that funding, and it was a little bit of a challenge to get groups to apply for that. This year, the state has asked that we really try to be more gender. It was a lot of male sports teams, so they really wanted to get more of a co-ed or female sports funded for that. That's kind of one area that was lacking throughout the state with a lot of the programs. And then we have youth sports and education as well. So there's 3 different funding streams of the funding to go towards.
Give me an example of the number 3, youth sports education.
Youth sports and education, that can be a lot of different things, like with summer recreation programs, any program that kind of has a recreational aspect to it that isn't necessarily a team sport. The team sport is very specific. It has to be like a soccer, a baseball, basketball
Right.
programs that are actually teams. The sports and education, we've done things with the YMCA over to Washington with their basketball intramurals, their summer camp where they do a lot of different recreational activities. The youth development aspect is more of like Chad receives funding through that because of the work that they do in the school, Cayuga counseling and groups like that that don't have that recreational aspect to it.
Towns and villages that have summer youth programs, would that be eligible?
Yeah, so, like the MIC, the Cato program, Town of Brutus, there are two programs I can think of off the top of my head, but they in the past have gone through the youth development, but the youth sports and education funding, that's through online sports gambling, so that's where that stream of funding came from, so that's been relatively new as well, where the state has asked us to, any of those recreation programs to kind of move those into that line, so we can focus on other youth development programs that don't have the recreation.
All right. Thank you, Deborah.
Thank you.
Thank you. So the next thing I'm going to do, in combining with reports, is I'm going to go to the tabled resolutions from July. HH3, HH4, HH5, HH6, HH9. 3, 4, 5, and 6 are from social services. So I'm going to pull those off the table. So if Christine, if you'd like to come up to help us address those resolutions, I'd like to do this one by one
These are from June or July?
from July.
From July, HH.
So they were tabled in July to this meeting. So HH3 is authorizing the Commissioner of Social Services to fill a caseworker vacancy on the child welfare unit.
Yep, so, yes.
So it's a vacancy with, a budgeted
Yes, this is a budgeted
position.
Receives reimbursement. And definitely critical need to fill this. We have, as I talked about recently in the last meetings, we have caseworkers that have high numbers. A lot of cases coming in, wanting to make sure that we have enough caseworkers to address the cases, do the work that needs to be done, make sure that we're able to meet the mandates, but also give families the attention they need.
Positions reimbursed at a minimum of 62%. Is that correct?
Yes.
Any other questions, discussions? Hearing none, all in favor?
Aye.
Aye.
Excuse me, but,
Gotta do motions, right?
Oh, the motion to pull it off the table.
well, no, you've taken it off the table, but you didn't.
Gotta put it on the table.
Second, to start two.
I'll make-
The amended, because the authorization should be valid through February 28, 2025,
All right.
because the policy
Second to
is
last
it's good
resolved.
for 6 months or the end of the year, whichever is longer, so.
Thank you.
Okay. I'll make a motion to amend,
No, put it on the table
put it on
for,
the table.
need a motion.
And
We never put it on
motion
the
to
table.
put HH3 tabled from 7/23/24
Move it.
on the table.
I'll second it.
And I'll make the motion to amend the second to last resolved.
I'll second it.
And you're changing the date to what Rich had said.
February
February
28th, 2025, 6 months out. Any discussions about the amendment? Hearing none, all in favor of the amendment?
Aye.
Aye. So HH3
No,
as
we-
amended?
Yep. We have to, we already got a motion. We gotta do a motion again.
So you just vote on
Just
the
vote on it.
resolution as amended.
Aye.
All in favor?
Aye.
Any opposed? Carries. HH4,
HH4 is requesting to fill a case supervisor grade B vacancy in the Child Protective Services Unit. This is open due to a resignation. And this is a supervisor who provides supervision and guidance to caseworkers in that unit. Manages the case assignments, provides supervision around decision-making, making sure that everything that needs to be in the case is being done.
can I have a motion to put this on the table?
I'll move it.
And a second?
I'll make the second for discussion.
Okay. Any discussion, any questions? We do have to amend the second to last resolve to February 28th, 2025. So I move to amend. Make that amendment.
I'll second the motion for amended.
Any questions, discussions about the resolution as amended?
This is, you're just filling this from within, correct?
I'm sorry.
This is being filled from within?
Yeah, this would
Promotion.
be a promotional hire.
Any other further discussion, questions? Can I have a motion to move to approve the amendment?
I'll move it.
Second if we have to.
And a motion to move HH4 as amended.
You need to take
I
a
mean-
vote, take a vote on the amendment first, then
Oh. I thought we just did.
you asked for a motion.
Oh,
Didn't
okay.
ask for a vote.
All in favor of the resolution as amended?
Aye.
Any opposed? Carries. Any further discussion? All in favor of HH4 as amended?
Aye.
Aye.
Carried. Did I get all 2 points there?
Yeah.
Both of them. Okay. HH6 or HH5 is filling paralegal specialists. When we discussed this, well, first I'll have a motion, put this on the table.
I'll make a motion.
Second for discussion.
Thank you. So when we discussed this or tabled this in July, we did have a discussion. And Christine talked about her willingness to amend this resolution at that time to fill this position at 50% rather than full-time.
Can I just?
Yep.
Okay. So we have in the 2024 budget, right now, it was budgeted for 2 full-time paralegal positions, paralegal specialist positions. I had, before last month, I had another paralegal position that we had got permission to fill. And I have put a employee into that position, but she's only working 50% of a regular work week. She is retired. She is ready to come back and do some work for the department. So she is currently in that position that was budgeted at 100% of a full-time employee. But we don't have her going at that rate of hours. And our intention is next year to knock down the funding on that particular position control number for that employee to be 50%.
Okay.
But
So I would like to bring in another full-time paralegal specialist. There definitely is enough work for the 1.5. And I think that it really is very necessary for us to fill this. There's a ton of work that needs to be done around calendaring and paperwork. We talked about this last month.
Okay, can I have a motion to bring this off the table and onto the table, HH5?
I'll move it.
Oh, I thought we already moved it for discussion. I'll
Oh,
second.
yeah, we did. We did move it.
I thought we
We
moved it
already
for
did.
discussion.
Yeah.
So you have one person in there right now working in a position that's full-time, working half-time. Is that my understanding? And you want to leave that person as half-time, is that correct?
for the remainder of this year.
And what happens next year?
So for our proposal for the 2025 budget is to have one full-time funded paralegal specialist and a paralegal specialist position that's funded at 0.5.
So if we pass this resolution as is, that would give you 2 full-time paralegal positions, correct?
For the remainder of the year.
Correct.
One, but what I'm telling you is my intention is to only have the one.
I understand your intention, Christine, but if we pass this, I'm giving you 2 full-time positions. And you're telling me you only need 1.5. So I propose we stick with the amendment to 0.5. And that gives you the 1.5 that you're requesting. That puts you right to where you want to be for next year at the 1.5. Am I right? I mean, am I missing something? Elaine?
If you're maintenance, I understand your
I'm sorry, yeah.
2024 budget as funding for 2 full-time paralegals.
Right, not a part-time paralegal.
You have currently in your budget 2 full-time paralegals. But you've got one person that retired that you're, instead of going through civil service and abolishing it and making it full-time, she's sitting there with part-time hours. Next year, when you compare your 24 budget to 25, instead of having 2 fully funded full-time paralegals, you'll propose to have 1.5.
Yes.
And that's where the reduction in staff will come from. Because you're not planning to ever take this current part-time position and move it back to full-time. You're just as a retired individual. And next year you won't have the capacity to do it because you're only going to be funded at
1.5.
right.
And I know Jen's on the call online, but one of the things that we talked about with the civil service is in order for us to have a part-time, an actual designated part-time paralegal specialist, that would be something that would need to go through the civil service process to create that actual part-time paralegal specialist position. We're actually accomplishing the same thing by just funding it at the 0.5 level.
Okay.
So I'm giving you my word that we're only gonna have.
So I think what you're getting at is there's difference between what's in the budget and the authorizations to fill.
Exactly.
Because I don't believe, and first, correct me if I'm wrong, I don't believe you have 2 resolutions currently in force authorizing the hiring of 2 full-time paralegals. I think that this came up as,
Remember, we passed it in the beginning of the year, and then there was talk about rescinding it. And then you had all of the legal issues and you had almost no DSS attorneys again. So
But I still have permission.
We never rescinded that resolution, so.
So when Pam, when this particular employee retired,
Yeah.
you know, we had permission to fill a paralegal specialist. We had no other paralegal specialist to do the work. We brought her back in to work the 17 hours a week. And then we're asking for permission to fill the other position.
Because the one we gave you permission for, you put Pam in. And see, that's what was not making sense to me when you brought it forward
Yep, I need somebody to do the work
right away.
right away, because otherwise I'd have 0 paralegals right now.
I understand that. I guess I'm still confused. Because right now, and correct me if I'm wrong, and Rich, if you're following me, correct me if I'm wrong. You have one budgeted full-time position that's being utilized with a current person that's in there working part-time. You tell me in 2025, you plan on having 1.5 positions. If I pass this resolution tonight, or if I vote yes for this, it's when I look at the math, this gives you a second full-time position. So are we gonna pull that back in 20? I mean, I'm not. I understand you use a full-time position as half-time. I get that. But if we made this a half-time resolution to allow them to stay, you could still hire somebody at full-time based on the prior position. Am I right or am I wrong?
I guess I don't know the answer to that. Maybe that's an HR civil service question.
You know what I'm trying to say?
yes, but I don't think you have there was a resolution in January to authorize the second, because in January they had a person working as a paralegal. Okay, didn't need authorization to fill that position. Person was already there. January, the resolution was adopted, as I recall, based on the budget to authorize hiring a second paralegal. that resolution would have expired in June of this year because the policy is the
No, a
authorization
year.
good for 6 months or,
And she has her hand up.
sorry,
Go ahead, Jennifer.
maybe I'm wrong.
I'm sorry. The resolution that we had, so in this budget for the year of 2024, we had 2 full-time paralegals budgeted. In January, we had one who was already working, and then we had a resolution to hire an additional one. We did not hire that additional one until Pam retired. And then we brought her back as a part-time. So even in the end of this, with you giving us permission today, we will
Okay.
still only have 1.5.
Right.
And we have budgeted for 2. And our plan for next year,
Go ahead, John.
and so our plan for next year is to only have 1.5
Budgeted
budgeted and hopefully filled.
and in place.
Yes.
Aileen.
So prior to this year, you always just had one paralegal.
Correct.
And 3 attorneys.
Correct.
So we added another paralegal because we were having trouble finding attorneys. And we said any help is help.
Yep.
And so then instead of filling a paralegal as a full-time, you wanted to make that a half-time. Or you want to fill it with a part-time
Right.
person.
Why didn't you fill it before Pam retired?
So that's my question.
We didn't have any applicants.
Right.
Oh, okay. So at the time, we had thought, right, because we are in need on the 6th floor, can't say that anymore, whatever it is. Because we needed help in our attorney's office. And we considered rescinding this paralegal and giving it to county attorney's office. But instead, there you go. You know, because at one point you were stacked with 3 attorneys, now you're not again. And
I was for about a minute.
Right.
And
Yes.
2 of my other resolutions are to fill a social services attorney and the supervising social services attorney. So I guess I'm.
You put Pam in the one position you had, and now all of a sudden you have an applicant.
I've got somebody that is a good lead and is interested. We have, I haven't made any promises to anyone because I don't, we have to get through this process, but I do believe that there's potential that we'll be able to have a full-time person that would be able to come on board along with Pam, who's doing the halftime work. We cannot get by with just a halftime paralegal. There's absolutely no way.
So next year, you're looking at going to 1.5. So if we approve this today and approve it in the ledge meeting, next month, your 0.5 paralegal quits on you. I have your word and reassurance that you will not be filling this position with another full-time paralegal that we have to cut for next year.
You do.
Okay. All right, I'm good now. Thank you.
I'm going to propose an amendment, third from the last resolved, changing December 31st, 2024 to February 28th, 2025. I'll get a second on that.
I'll second it. It's fine.
All in favor of that amendment?
Aye.
The amendment carries. HH5 as amended, all in favor?
Aye.
Aye. Any opposed?
Yep.
Carries. Okay, HH6 table. These are the positions to fill 4 seasonal heat workers. This is 100% federally reimbursed. And much of these HEAP assistants help hundreds and hundreds of our elderly citizens and our very vulnerable citizens. So HH6, motion to bring this on the table.
I'll move that.
Second it.
I will move to amend HH6. Again, this would be the second to last resolve, changing December 31st, 2024 to February 28th, 2025. A second on that amendment?
Second.
All in favor
Aye.
of HH6 as amended?
Aye.
Carries. So HH6. Any questions, any discussions? Questions for Christina? The HEAP program? It's about a 6-month program, federally funded. There'll be another.
You're still able to get yourself up and running, because I know you usually start in August, you stated.
Yeah, my
Timeframe.
original thought was that we would bring on board one of these, 4 positions in August to help us with all of the prep work. Last year, there was 6,000 heat issuances for the county from the start of the heat season through July of this year. Still some more that will come in. That includes the actual heating portion of the heat program, plus the cooling and the furnace repair. So there's a large volume of folks in the county who receive benefits from this program. And with that is a ton of paperwork. Everyone that's already on assistance that receives benefits like SNAP, Medicaid, they're categorically eligible based on their income to receive those other programs. So there's a lot of work that we can do to get ready for the heating season portion of HEAP, to make sure that we have the vendors correct that are issuing the fuel, delivering the fuel. People move, they don't let us know. We get mailings, a lot of the stuff comes back. We have to do research on where they've moved to make sure that we have all of the accurate information so that when the benefits start to go out for HEAP in November, so that the benefits start going out in the regular season in November, we're ready and we have everything. We have a lot of the pre-work done. There's some pre-eligibility stuff that we can do. So yes, it's helpful. We weren't able to bring anybody on board in August. I told Heidi that we could definitely make it work to do what we typically do, which is bring in 2 in September and 2 in October.
Okay. Any other questions? Hearing none. HH6. All in favor?
Aye.
Aye.
Any opposed? And it carries. Thank you, Christine. So we have one tabled resolution from the Office of Aging, HH9. I'm going to have the department heads jumping around tonight because of what we're taking off the table and what's new to the table. So HH9 is authorization to fill an aging service specialist due to a planned retirement in the Office for Aging.
Make a motion to put it on the table.
Thank you.
Second.
Brenda, how many aging specialists do you currently have in the office?
We have 1.5 caseworkers for the basic program specifically, which is what this one is.
Okay. And what exactly does that do?
So it is a program that has been longstanding since the 80s, and it was the key program to keep people at home by providing case management, aid service, emergency response pendants, and oftentimes the folks also get meals and sometimes transportation or other ancillary services. So this person makes sure all that happens, people in their homes and out of an institution. Some folks need a lot, some folks need a little, but it's definitely a full-time job.
Okay.
I have a question about that the position will be vacated end of October. You're bringing the resolution now. Do you anticipate a difficulty in getting the position filled, or are you anticipating a side-by-side training period?
Yeah, because like other positions, there's no list. So I'm gonna have to advertise and see if we can find anybody and bring them in to interview. And I'm not asking for overlap. I just want continuity. We have a supervisor that can train the new person. We just need the person to be able to be there for those clients that are calling and looking for assistance every day.
Okay.
And it is 80%, I'm sorry, 75% reimbursed.
Oh, that wasn't on here. Okay, all right, see that. Sorry about that, Brenda. I didn't see that. Thank you.
I noticed too that the very last resolve will need to be amended to February 28th, 2025. So I offer that a motion for that amendment from change from December
Yeah.
31st.
I'll make the motion and.
Any discussion?
No.
All in favor of HH9 is amended.
Aye.
Any discussion on HH9? All in favor of HH9?
Aye.
Aye. Any opposed? So carried. Okay, thank you. That takes care of our resolutions which were tabled.
Okay, that's that one. So it was. I still wanted to know what it was, but. I believe
So-
last meeting.
I'll follow the agenda from here and ask our department head Kathleen Cuddy to give us updates, and I know she's got a couple of resolutions as well.
Hello, I'm not gonna be quite as fast as, Riley was. I will be faster than usual tonight. Would you like me to start with resolutions or with an update?
Let's start with resolutions. So we have HH1 and HH2.
Right.
Let's take HH1.
We are looking to create and fill 100% funded competent professional authority or nutritionist. They are both the same grade for our women, infant, children with program. We need to maintain our program requirements and keep caseload. We write it specifically to be one or the other because there are educational requirements that differentiate what those roles are, but it is the same grade. And this is something that needs to meet the Fed requirements as well as civil service requirements locally.
Okay. In the last resolve, I'm going to offer an amendment. Again, changing December 31st, 2024 to February 28th, 2025. Second on that motion.
Anybody's put it on.
Never put it on the
Oh,
table.
sorry. We put HH1 on the table.
Move it.
Thank you. Thank you. So I'm going to offer that amendment to HH1.
Move it.
Thank you. So this is 100% reimbursed. And I noticed your language that you are funding of the WIC grant until funding of the WIC grant no longer covers the salary and fringe at 100%. Thank you. That's clear. Any discussions, any questions? Hearing none, all in favor?
Aye.
Any opposed?
Go.
Carried.
And thank you. Our second resolution is a request to fill a principal types position in the health department. Specifically, we had discussion at our personnel committee meeting, and we went through the process to assess this situation. We have an employee who is identified as working out of title, and we're being placed into the principal typist position. Will be an appropriate placement for the work that this individual performs. And we are not looking to fill behind.
Can I have a motion to put HH2 on the table?
I'll move it.
Second.
Thank you.
So if nobody's changing jobs, you're just changing job titles and descriptions.
Correct.
And what determination or
Yeah, there was an assessment of duties and work performed by this individual that was it was done by the individual, looked at and observed by the supervisor. This is a months-long process, and considered by HR and Human Resources.
Okay.
And discussed at the Personnel Committee, and more than half their time spent working at the higher grade.
Okay.
Thank you for taking it through all of those channels and that research before bringing it to us. I'm going to ask for an amendment to HH2, the last resolve, to change that from December 31st, 2024, February 28th, 2025.
I'll move it.
Thank you.
Second.
All in favor of HH2 as amended?
Aye.
Aye.
Aye. Any opposed?
Aye.
Carries, the amendment carries. HH2, any discussions? Any questions? Hearing none. All in favor, HH2?
Aye.
Aye. Any opposed? No opposes? Any opposed? HH2?
No, if I was, I would have said so.
Okay. I didn't hear the aye, I'm sorry. Carries HH2.
Thank you. Just a few brief updates today. I like to kind of share some of the outreach events that we do because I think it's important for people to know that we, work throughout the county, right? I think sometimes things might be more visible when we're out and about in the city, but we make an effort to go various places. So as we gear up for back to school time, we had people participating and will be participating in Booker T. Washington back to school giveaway and a number of the open houses around the community, including Moravia, the middle school. We will be attending in September the elementary school in Moravia, the senior fair hosted by Office for the Aging, Cato Meridian Junior Senior High School open houses, Weed Sport, Port Byron open houses, and some others. We've had a lot of outreach events that recently you'll see our Healthy Neighborhood staff working in their designated areas and attending different events that coincide with community events like the firehouses and things like that. So it's a busy time during the summer, which is in a good way in that regard. We had the pleasure of being able to participate in the Public Health Fellow Program again this year. So this is Public Health Fellows 2.0, which began on July 1st. And that has enabled us to acquire 4 fellows, which are people who might not work in public health otherwise and don't have the classic background for working in public health to come and work in various capacities. It's paid for through state funding. We don't even work as the carry through. The state hires these fellows on PCG. We have 4 individuals who started and they're doing a great job. So far, so good. And we're really pleased to have that. It really helps us significantly in a lot of supporting the work that we do, especially in particular when you have different turnover, and they can really help fill in some of the gaps temporarily in some of the not as highly skilled particular jobs. I will be coming forward, I think, as a community, we're going to be eventually looking at some new ways to attend to our rabies prevention and control program. So I'll come forward probably next month or the other. We have some more specific plans to share with you about that, that we'll need to take some time to figure out how to best perform this required program. And the tobacco law at the last meeting, this committee asked if I would go back to our Board of Health and speak to them about 2 requests regarding the updated revised tobacco law. The Board of Health did take your considerations and have some discussion around them regarding 1, how frequently permitting should occur, and 2, whether there should be a cost to obtaining that permit. So the board agreed that annually is a good idea. The permits that are in place currently for issued in January 2024 were good for 2 years. So we'll have to work with Fred Westfall or Rich and whoever is refining the proposed law to identify how we, initiate that into then an annual term. And the board looked to see what some of the time that is spent for someone to get their initial permit and required inspections. And while it's not the perfect, it's not the precise amount, they looked at the work of a sanitarian and some of the hourly rate around that sanitarian. And at minimum, it's 3 to 4 hours per permitted facility if there are no violations. And so in keeping with that, they kind of averaged about a 3 hours per permitted facility. So they propose the idea of $100 permit fee. That's based on the hourly wage of our sanitarian who does that work. So in speaking with Fred a little earlier today, he asked if I would request of the committee, what is your desire? Would you like us to make the revisions to that law and bring them forward to Ways and Means and then to the full legislature? Or would you like us to wait until September and bring that forward? We know that there needs to be a date for public comment period prior, that's about 30 days, and then prior to the vote.
Doesn't seem to me like there's a big rush to it, correct?
You know,
I mean, really.
starting at the beginning of the year is always the cleanest, so we have a little.
So I have no objection. I think, no, I don't think there's any issue waiting until September. I don't think it's something we have to do as a 911. Does anybody agree or disagree?
I agree.
You know, that gives time and no one's rushed for next week's, for 2 weeks from now, right? So, right.
Yeah, that's totally fine from perspective of our department.
Okay.
Okay.
Yeah.
I'm in agreement. Anybody else have?
I just want to say
Any other
thank you for
discussion?
taking our ideas and presenting them. I appreciate that. I also, just a little sidekick. I'm not on social media a lot, probably should be on there more sometimes, I guess, but I do follow your Facebook page and I can see you guys had a very busy summer out and about in the community. I think it's great. You're doing a great job. Your department's doing a great job and just being out and about and advocating, you know, as simple as even bicycle safety and helmets and those type of things. But I'm glad to see out in the community, and you guys were up in Fairhaven not long ago as well. I wasn't available. I wanted to stop by. I wasn't in town. But no, I can see what you guys are doing throughout the county, and I find that you're throughout the county. So not just like you said in the city, but you're in the north and in the south, and it's really good to see that you're up in my area. So I appreciate that. Thank you.
Well, thank you for recognizing that. And I have to give credit to, you know, our education and information division really tries to keep our social media active and interesting also.
And I share your posts whenever I can. So I don't know who posts more, you or the sheriff, but you're both up there. So,
We're
you
in
know.
competition, but I'm not going to admit.
All right. I know, Brenda, I'm sorry. I follow you guys as well, but yes, I know.
Thank you, Kathleen. Lauren Walsh.
You want me to do the resolutions first?
Yeah, so let's do HH 9 and 10.
Okay, so HH 9, Community Services Board was given the opportunity to look at all the opioid settlement funds that have come to the county and make recommendations of how those dollars should be spent. So we issued an RFP in the past, and we opted to fund for 5 different agencies. So we've met more recently, and the Community Services Board is voted in favor of continuing to fund those programs that we've already been funded. And basically that is due to feeling like if we stop funding those, that we would just recreate gaps in our community. We took a lot of time looking at what gaps were here and what we wanted to fill. So we feel like part of what we've asked the agencies to do is give us a sustainability plan so that they have plans that after this funding runs out, that they will be able to continue the programs that they've been able to fund with us. So just some of the things that we funded, we have funded, so the mental health center gets $75,000, and that is to fund, help fund some of the Narcan distribution programs, as well as, you know, community outreach campaigns and different things that we put out to the community as far as making them knowledgeable about what's going on in our community with, you know, different substances. Nick's Ride gets $95,000, and that's for 2 separate programs. One is they provide a peer position at the VA or at the hospital. And that's really about bridging that, you know, people that are in the hospital, whether that's the VHU or in the hospital in general, is kind of bridging that to get people in, you know, after they leave the hospital to be able to
already have known up here, get them, into next rise so that they can, get into treatment or, access other resources that they might need. And then the other 25,000 is for, 20,000 is for, it's called Breaking Barriers. So this is a fund that it lives at Nick's Ride, but it's really about any barrier to somebody getting into treatment. Could be they don't have a cell phone, or they need to stay at a hotel for a night before they get into a bed at a rehab. So there's been tons of reasons why we've used that, some very small amounts of money that go a really long way to being able to bridge that gap to getting someone where they need to be. Cayuga counseling, $75,000, and that is to fund a CASA therapist, which is children affected by substance use. And this is an evidence-based program that provide groups, individual counseling to children who have parents that have had some substance issues, and that kind of helps them be able to process through that. And then we also fund CHAD at $75,000, which this is to really enhance their prevention program. So they have worked really hard to get into more school districts in the county to be able to provide substance use counseling to kids in the high schools and middle schools. So that funding has been able to help them. And then last but not least, more recent funding has gone to Cayuga Health Network. I think, this is for a transitional housing program. So this is people coming out of jail and or treatment, or that are homeless that need a place to live, and it's transitional. So it's really meant to be about 90 days. And they've been, I know it's new, but they've been very successful in getting people into permanent housing following that time period. Some people even leave a little bit earlier than the 90-day window. So I think this money's going in really good places, and I think, we're filling gaps that were existing prior to this.
I have a motion to put HH9 on the table.
I'm with you.
Second.
Any questions or discussion for Lauren? Hearing none. All in favor of HH9?
Aye.
Aye. Any opposed? Carried. Thank you, Lauren. And you also have HH10.
The resolution is to adjust our budget to pay for our competency exams or forensic care of our people that are coming out of jail that need psychiatric treatment. So anybody that is incompetent, they would go to a state hospital. We have to, that's in our budget that we pay for that, and it's very expensive. But this amount is what the projection that we have for the end of the year of who we have in there now. And if they stay the full time. That doesn't mean that they will. It doesn't mean that they won't either. So it's not up to us, it's up to the hospital if they feel they've reestablished competency to be able to come back to the jail.
I'll move it.
I'll second.
Lauren, this is another state mandated unreimbursed cost. Is that correct?
Correct. There was a time that OMH paid 50% of the cost, but not anymore.
So it's fully 100% out of the counties, passed on from the state.
Correct.
Thank you.
And when this goes on to Ways and Means or full ledge, if it goes on, this is going to require 2/3 vote because we're pulling it out of contingency.
I have one more question. You've already expended your estimated cost for the year for this, is that correct? Which is why you're coming back to us,
Yeah,
because
this is also not the first time to come back.
and
Budget.
all right.
Which you gave us a heads up on.
Yeah.
Okay.
Yeah.
Knew this was coming.
Yeah, you have last meeting or two, let us know. Some expenses were.
Yes, and I know Grace and Lynn are also well aware of
Yeah.
that as well.
Any other discussion, questions? All in favor of HH10?
Aye.
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 Any opposed?
Nope.
And it carried. Do you have any updates?
Yeah,
Mark?
just follow updates on staffing. We did hire two social workers. One has started. And one is starting in the middle of September. However, we also had, leave as well. So we do have a number of positions that are still open. We've had some, although we've had more interviews scheduled, so I'm hopeful that we can fill some of those positions. It's especially important because we really want to get into the schools to do, with our grant that we got from Stanza. We want to be able to have our social workers get into the school districts to do what they're intended to do there. And we need to have people at the clinic to cover the other kids, walk-ins and whatnot as well.
That's the DBT work?
Yes, the DBT in the schools grant. So everything's moving forward with that. I think we will be at a good place. If we're able to hire one or two more social workers, I think we'll be in a really good place come September, which is when everything is gonna be starting in the school districts. So hopeful, but we did lose somebody in the meantime as well. And then just a heads up to our full-time psychiatrist is also gonna be retiring at the end of October. So I'll be bringing a resolution forward next month to fill the psychiatrist's position. Not always the easiest position to fill, so I think, getting that through is obviously very important so that we can get a psychiatrist. He is our only full-time psychiatrist, actually, that we have. All other, we only have one other that's contracted with us, so. So you guys have a heads up. And then just the other piece is our EMR, our electronic medical record will be no more. It's going away, we're thinking by the end of the year, if not the beginning of 2025. So we've been doing our homework and really researching a lot of EMRs that meet our needs. This one has been a little outdated for a while, but I think we're at a point where we have to make a decision about where we're gonna go come next year. So I just want to give you all a heads up about that as well. But that's something we've been doing. We've been very careful about, we've interviewed and met with a ton of them and we've narrowed it down to, I think, the ones that really are gonna, help us in a lot of ways. And I think one particular way is that, if a treatment plan isn't signed by the people it's supposed to be signed for, we have no mechanism other than manual audits right now that would prevent billing to go out. So sometimes we catch those errors after the fact and we do have to pay back Medicaid money that would have normally been ours. So that's a huge thing when it comes to our new EMR, that there are those checks and balances, that those would never go out for billing. Because there isn't a signed treatment plan, or the treatment plan isn't signed by all the required people that have to sign it. So we're really hoping that'll reduce the amount of errors that can happen paperwork wise, and we would have to reimburse Medicaid. So we do feel like that's a huge piece to the new EMR that we choose. So that.
Would that new program also help you identify ways to get the signatures needed so that you can get those reimbursements?
Yeah, so right now you have to manually send an alert to the next person who has to sign.
Yeah.
It's all automatic. It would be pre-assigned ahead of time, and once the therapist signs, it would go directly to the medical provider. And again, nothing would go out for billing because if it's not signed. So there's a lot more checks and balances to the newer program. So I do think it will be really helpful in the long run. It might be, more expensive than we're paying right now, but I do think it would be saving us money in the long run if we're able to have all those checks and balances in place. So.
Okay.
Yeah.
Looking forward to that. Thank you.
Yep.
I am going to switch up order again and have Brenda come up. I do have one resolution before we head into the social services resolutions. So if we want to look at that resolution, it's HH 11. This is also a fill. Authorization to fill a food services helper in the Office of Aging. Do I have a motion to put that on the table?
I'll second.
Thank you. Any discussion or?
Brenda, this is the same thing. You have somebody resigning and you're not looking to fill it side by side. You're just looking to bring them in after the move to fill the position after the retirement.
This person resigned unexpectedly.
They resigned unexpectedly. Okay.
It's the daily food service.
Oh, so it's currently empty right now. So we gotta get this. Yeah. Okay.
And this is 100% federally funded position.
Yeah.
I am going to make an amendment in the last resolve to change the December 31st, 2004 date to February 28th, 2025. So I'd like to make that motion. Can I have a second? Thank you. Any questions or discussion on that amendment?
Maybe I should check my glasses. Retirement and resign don't even look the same. They both start with R, but that's about it, right?
Pass.
Um,
All in favor?
aye.
The amendment? Any opposed? So HH 11. Any discussion? All in favor of HH 11?
Aye.
Any opposed? Carry. Thank you. You have updates for us?
I just want to talk just briefly about the Cayuga grandparent program, because I had brought that to you a few months ago and said we were going to be implementing it. We had kind of let some other counties experiment and figure out some of the obstacles to implementing it. And at this point, we're willing to move forward again, still kind of slowly and cautiously. We're primarily looking at being able to use it where the scat van can't take people and where those with Medicaid can't get medical transport. We're prioritizing medical transportation, and we're also prioritizing medical transportation out of the county because that can be tough. So, but we are definitely taking calls, signing people up. We're authorizing a limited amount of money per person. And if they use up that money and we still have funding left, then we can perhaps reauthorize. We're going to have a conference call in 2 weeks to find out a little bit more how this is going to look ongoing, what the funding might be ongoing. And I use that word funding, but the really nice things about this program is that instead of the state actually sending us the money or authorizing the money and then we have to bill for it and all that, they have given a credit to Go-Go Grandparent for our county. Basically, they're handling it at the state level. So it's great.
Are you getting good feedback from it so far, the Go-Go Grandparent app?
You know, people have been, yes, they've been surprised how quickly people have showed up. We have had to be smart about our rural locations and allow for more travel time than they might normally expect to have to do.
Okay.
But cars have been reasonably clean. They tend to be Uber drivers is what we're finding. And drivers were pleasant. Somebody who needed a little assistance or a little side by stand assistance to get in and out of the vehicle, to get to their railing, that was provided. They can't do hands-on, but you know, put walker in the car, those kind of things. So far, so good.
Good.
Yeah, cautiously optimistic.
And just a shout out to you for, I know you're gonna be in Sterling and I see you're hitting Moravia as well. So nice to see you in the north and south in the towns again. So thanks.
I have a
Like
flyer
that.
for you.
All right, super. I'll grab it from you afterwards.
And great success with the senior farmers market coupons as well.
A couple new records in a couple locations. So,
Yeah.
That was great. And I give a shout out to the highway department because they did set us up with double lanes this year at the mall. So we were able to get cars through twice as fast. So that was great.
Thank you. Thank you. Okay, Christine Bianco, up again. Let's take a look at resolutions first. HH3. This is create a social services commissioner to fill a junior account, grade 19 position, and abolish a principal accountant clerk. Motion to put this on the table?
Move it.
Second.
Thank you.
Talk about this?
Yes.
Okay. So really what we're doing is we're asking to turn one of our positions into a junior accountant and in an effort to really be able to distribute work in a way that allows more people in our accounting area to be able to do more of the cleaning functions and more of the complex accounting. functions. Right now we have one grade 23 accountant, and then our next highest grade person that's in the accounting area is a grade 10. And with their job title and the duties that they're allowed to perform, we have really been constricted, I guess is the best word, to be able to distribute the work in a way I think that's going to help us be able to portion out work to people that in order to like better make sure that we're keeping track of funding and reimbursement. It's something that we have been talking about doing for a while. And with the principal top clerk 2 resigning from DSS to go up to the finance department of the county, this really gave us an opportunity to look at this and look at the duties that she was performing and some of the things that we feel like we need to do to be in better shape. And that's why we're bringing this forward.
Questions, discussion?
This won't be, is this an internal move or you don't have somebody in the account clerk 2 position currently?
We did have somebody we don't now.
You don't currently?
No, we do not.
I just have a question, and this question is going to pertain to pretty much all of them. You're still not in a space. People are working from home, correct? Still, or you have spaces throughout not everybody's remote. You have some remote, not remote, or is everybody now, is that kind of mixed in?
A lot of our, almost all of our accounting staff are actually have places to work.
We
We have some of them,
You got some at the courthouse, or correct?
we have some at the courthouse and we have some, I've got like six different locations that we have.
So they're spread out.
Training has 6 of our accounting staff right now.
Okay,
That's
so,
where this person would.
so bringing people in at this point, being able to train is more effective since you have locations to do so. Yeah.
And this has gone through, you did an evaluation process, worked with personnel and the personnel committee.
With went through the personnel committee. I don't know if we did that, this one. I don't know if we did. Jen, do you know if we did?
It went through civil service to classify the position, and they classified it for us, and now we're bringing it forward to be created.
Okay. And it is reimbursed with 62%.
Yeah.
I read that.
Yeah.
And completely abolishing the
prior position.
The principal.
Yeah, so it's still a neutral position.
Okay. I'm gonna offer an amendment again. This is the third to the last resolve, changing the fill valid date from December 31st, 2024 to February 28th, 2025.
Motion.
Thank you.
Second.
Any discussion or questions about that amendment? All in favor of HH3 as amended?
Aye.
Aye. HH3. Any further questions, discussion? All in favor?
Aye.
Aye. Any opposed? Carries. HH4 is to create the Commissioner of Social Services or to fill 2 human service examiners in the HELP program. I think we've talked about the HELP program quite often and have found it helpful in social service, particularly to get caseworkers on board more quickly without the examination process. And there's 2 of those to fill?
Yeah, so these are
Examiners.
2 human services examiner positions, actually not caseworkers, but human services examiners. That are, they qualify in the HELP program, and we would need to, that's why there's a create on here. These are not new. We have budgeted human services examiner positions that are vacant, and we're looking to turn them into the HELP type human services examiner position. So that's why we need to have the create language in there. So we would be unfunding the human services examiner positions that we did have folks in.
Can you take 1 minute to educate me? I know what a caseworker does. What's a human resource examiner do?
Human services examiners
Resource
are the folks that are on the temporary assistant side of the department. So all of the different units that you have, Medicaid, temporary assistance, our intake unit, our SNAP, all of those program areas have human services examiners that do a variety of things, determine eligibility, maintain cases, determine eligibility for chronic care, Medicaid, meet with the public, answer questions.
How many do you currently have?
How many do we have? I have that on my laptop.
Sorry.
We have a large number of them. We have, in that area of the department, we have 57 people, including the supervisory staff, the human services, we have a lot of them. I would think Jen probably knows better, like the top number off the top of her head, but, we probably have
37.
37.
37.
Of close. It's a lot. And they are the line staff that talk with, the clients, meet with the clients, do all of the paperwork that has to do with getting out the benefits that they're eligible for, recertifying the cases, closing out the cases.
I'm going to offer an amendment to the third from the last resolve, again, changing the fill date language from December 31st, 2024 to February 28th, 2025. Motion for that amendment?
Motion.
And a second?
I'll second the amendment.
All in favor?
Aye.
Aye.
Aye. Any opposed? The amendment carries. HH4. All in favor?
I'm gonna vote yes on this today to move it to Ways and Means. But that does not ensure that I'll vote yes at Ways and Means. I want to look into it further, but I'll vote yes on it today.
Aye.
Aye. Any opposed? And it carried. HH5 is filling a director of fiscal management. Let's do a motion to bring this to the table.
I'll move it.
I'll second.
Thank you.
So this is our, really the director of our fiscal area in the department, social services or accounting area. We talked about, this was a position that we had a very hard time filling. For a very long time, it was vacant. This was Grace Beller's job when she was still with DSS. We were able to fill the position with a individual who we had working for 8 months for us. And unfortunately, we did not retain that person through the probationary period based on our assessment of her work, her ability to do the work. So bringing it back with the need to have that position filled, that this accounting area in DSS is so important for us. I mean, we have a huge budget, huge amount of money that runs through DSS, reimbursements, claims. There's 10 staff in that area. So this person also provides supervision. And we really need to work on getting someone in there at a time.
Right. As you noted in your rationale, this is the largest mandated budget for the county. Well, I'm going to offer again the resolution to amend the second resolve, offers a bill valid date from December 31st, 2024 to February 20th, 2025. Motion for that amendment.
Second.
All in favor?
Aye.
Aye. Any opposition? Carries. All in favor of HH5?
Aye.
Aye. Any opposed? Carries. Thank you. And go back to a familiar subject for us, authorization to fill supervising social services attorney position in the Department of Social Services. This is HH6. A motion to bring that to the table.
Move it.
Second.
So bringing this forward today because we've had resignation of the supervising social services attorney. And for a long time, we've been struggling with our legal staff in DSS. And have been leaning heavily on the county attorney's office. Right now, Fred and Rich are helping us. We have a number of other attorneys that we have had brought on board with the resolution to be able to bring them on board earlier this year. Helping out with child support, adult protective and guardianship cases. We have another attorney that's helped out a little bit with appeal work, but we really need to really buckle down and we're gonna have to get together with HR to kind of strategize on like how we're going to approach this. Trying to get a supervising social service attorney because a couple of resolutions down your list, we also have the need to fill a social services attorney position. So that right now, we have one social services attorney. We have the paralegal that's working the half-time. That's all I've got. We're budgeted to have a supervising social services attorney, 2 social services attorneys, and now we'll have hopefully the 1.5 paralegals. We haven't seen that in so long.
Yeah.
And it's been very, very difficult. We're patching things together, but it's definitely not ideal.
Well, again, I'm going to offer a resolution to amend HH6 at the third to the bottom, or the first resolved, to change the valid through date from December 31st, 2024 to February 28th, 2025. Motion for that amendment?
Move it.
A second, I'll second. All in favor?
Aye.
Aye. Any opposed? HH6 as amended carries, so HH6, any discussion? Hearing none, all in favor?
Aye.
Aye. Any opposed?
Aye.
And it carries. HH7. I'm going to talk about contracting for a minute. This is again the HEAP program, authorizing the chair of the legislature and the Commissioner of Social Services to enter into contract with CAP, with the Community Action Agency or Action Programs of Cayuga, Seneca, to perform outreach activities for the state mandated HEAP program, which is 100% federally funded. And goes from September 1st through April 30th. A motion to bring HH7 to the table.
Motion.
Second.
Thank you. Any discussion, any clarification for us on the resolution?
I can talk about this a little bit.
Okay.
So this is the contract that we've had with CAP. They are really our outreach provider to help with management of the HEAP program through the year. Any member of the community that wants to go into their agency and apply for HEAP, have help with completing applications, help completing the online application goes there. So they take a ton of phone calls. They help complete a lot of these applications for emergency HEAP, and even folks that want to just get on HEAP for the first time with a regular benefit. They sit with folks, do the applications, kind of time consuming. That's a great place, the CAP agency, with the folks that they serve. I think it makes sense for it to be there at the action agency. They really do a lot of prep work for us. And then once those forms that they have completed come to us, then we have to audit them, make sure we check them, and then do the work entering into the computer for the different vendors to send out the HEAP benefits. They work nonstop really for 24 weeks. The contract is for a 24-week period of time for them to hire those workers.
for those months that they are helping us run the heat program. We would not have the capacity internally.
Any questions?
Is there a way to apply online, or is it always in person, or can people apply online as well?
Yep, you can apply online. You
Online?
can apply in person. They do a lot of help with folks that have literacy issues, that don't have their own computers. And folks that come their way through other areas of the community action agency, they will help them learn about things that they might be eligible for benefits.
So for example, like in the extreme ends of the county, is there like a place where, a website or something people can go to, or where would I find that information?
There's a lot of information right on our county website.
County website.
Under DSS, under heat.
All right,
So there's information there. Like I said, the heat program is anticipated that it's going to open November 1st for regular benefits, and then there will be emergency benefit timeframes as well. There is a ton of information on the website about it links you into the
Application and
Yeah.
so forth.
Yep.
And then if there's questions, these are the CAP would be the ones reaching out to them.
CAP would be.
Well, that's what I'm asking
We get a
them.
lot of phone calls too. So, I mean, between the Department of Social Services and CAP, it's a pretty steady volume, especially at the beginning of the season and then when the emergency season opens.
Okay.
So, yeah,
Right.
there's numbers on there for both.
Thank you.
Any other questions, discussion? Hearing none, all in favor of H87? Aye. Any opposed? Carries. HH8, also a contract renewal. To enter into contract with Northwoods for the provision of software solution technology and services. A motion to bring HH8 to the table?
Move it.
Second.
So this is the Northwoods program that we have in our child welfare and adult services section of the department. We've had this for a number of years. We moved from a lot of paper-based transporting paper to folks' houses to have them fill out forms to this software, the solution. Worked really hard to get a lot of forms and our documents digitized with the help of this company to allow the workers that are out in the field to be able to have what they need at their fingertips. When they're working with a family, they go in, they have what they need. Oh, this is something that you need to apply. Here's the application we can do. They have Surface Pros or laptops that they utilize. And then the function is on those remote devices. The other thing that they do with this application is they can enter their progress notes. They can start their progress notes when they're out in the field, if they're in between home visits, or maybe they're up north and they have like an hour break between a home visit. They can go pull off somewhere. Sometimes they go to the highway or sheriff's substation or something, sit there in the parking lot, type up some notes and get a head start on what they need to do. The purpose of this was to help them be more efficient, to help them make sure that they have what they need to meet their deadlines, so that they're not having to have someone run back up north to bring somebody an application or a paper. They have it all right there with them. So we worked really hard to have all of that stuff uploaded into this cloud-based system so that they can, as long as there's, they can get the cell service, they're able to access all of those documents, and it works really well. And we've moved away from a lot of paper. We scan things in through these very fast scanners. They get into the system, and when it helps, because when we want to look for information up on a situation or a family that we're working with, you go right into that system. You can type in some keywords. You don't have to flip through a big file, thick paper file. When you're looking for information, historical information about relatives, maybe we could tap into if a family has a situation where they need a respite, or a child needs to stay with a relative for some reason if there's a safety issue, or if the family's just going through something and they need a little bit of a break. We can say, hey, what about this person? Because we can find that very quickly in the record. It's worked very well.
How long have you utilized the service?
Oh.
Like pre-COVID? Pre-COVID?
Oh, yeah.
Okay.
Yeah.
So obviously it's been helpful with the various going remote closures, et cetera.
It happened a little bit before COVID and we said, thank goodness we had it. because it was what helped us get the workers in that section of DSS, the ability to work remotely. So that was the part of the department that could kind of flip the switch to easily go remote because we had implemented the notebooks. We had the technology. And still now with the building situation, same thing. You know, the forms and things that we have are stuck in the building, and for a while, you know, we had to order some paper forms, but they had a lot of, they needed, so it's right there digitally.
Any other discussion, questions on HH8? All in favor?
Aye.
Aye. Any opposed? Carries. We have one more. This was a very late resolution. You may have to take a look at it. This is HH12. It actually came in a revision to your HHS agenda this morning. And this is a resolution to authorize the Commissioner of Social Services to fill a social services attorney. We had a resignation end of last week, I believe, on Friday.
No, just a couple of days ago.
Just, yeah, okay. Early this week, okay.
This week.
Okay.
Unexpected.
Put you at one attorney right now.
Right, this attorney's still here until the end of next week, this resolution.
Right.
It's in that position is here until the end of next week, but he hasn't been with us very long, and I think honestly, this is probably a little bit of a casualty of the, you know, not having a supervising social services attorney and also not being in the building. You know, the feedback was really that it's very hard not to have a full-time office and to not have a full-time paralegal. And, you know, I think that it just kind of illustrates that not everyone is doing okay with the way that things are right now, but it is very stressful, and, you know, people are different around what they are able to, you know, to manage and, you know, kind of tolerate with some of the disruption that we've had.
Any other questions, discussion? Do we put this on the table?
No.
I don't think it is.
Yeah.
Okay,
I'll second.
thank you. Questions, discussion on HH12? Hearing none, all in favor?
Aye.
Aye. Any opposed? Carried. Do you have department updates for us after all of that? Just keep you talking, Christine.
A lot of resolutions, well, you know, being along with the being displaced, you know, we still have workers, you know, kind of scattered at different sites, trying to, you know, get ourselves every day, trying to figure out better ways to be organized, to be more efficient with the kind of the way things are working right now. Not always easy, definitely, makes it difficult to be as efficient as we'd like to be in certain processes.
Can I ask a question about that? On a given day, do workers know that they have to have an assigned site of the scattered sites that you have, or are they moving?
That's like a mixture of things. We have certain workers that are in a location all of the time.
Mhm.
They have an assigned site to go. We have some folks that, you know, come over here, right here. And when this building is available to us and sit along the tables and, you know, can kind of plug in when they need to. We have staff that are sometimes home. Sometimes they find a place to land here in Auburn. You know, so it's really a mixture, but right now, like, I feel like everybody kind of knows, like, you know, what we have for them. I recently provided information to Steve Lynch and to Shireen that was an effort to sort of gauge, like, what does DSS need as far as space going forward, since we know that we're gonna need a little more time. We're working out what's happening with the building. What I have right now is not sustainable. So, like, taking a look at what do each of my sections actually need. Trying to be mindful of, if we're going for a little bit longer period of time, it's one thing to go for a month or two, but it's more if it's going to be a lengthier stretch. I need space for supervisors to be. I need space for supervisors can meet with their workers to supervision on cases, to talk to them about how they're doing. You know, that the workers have let us know that loud and clear that they need that. So trying to build that into the planning, taking into account things like where we can store records that we have, you know, provide conference rooms so that we can have team meetings that we need. Just like trying to like pare it down, because we're definitely not gonna be duplicating what we had in the county office building, but what's the minimum that we think that we can live with if the county was able to procure space somewhere in a way that, the department could utilize to have more of us in one space, hopefully. So I tabulated that information. We had a meeting with the supervisory staff to talk about why we are asking them this, and definitely not promising them anything at all, but just saying like, what we want you to consider this. And so they sent all of their information to me, and I looked at it and I tweaked it a little bit and sent that information back to the operations team. And, I'm sure there'll be more conversations and discussions about what I sent in, if there's feedback. And, hoping that will lead to us being able to have something that's a little bit more what we need, honestly, what we need.
Thank you.
Just a little update on our homeless numbers, kind of remaining steady, honestly. Right now, we're in the thick of summer, but we still have 36 families as of last week that we were providing emergency housing for, and 110 single individuals, utilizing 7 hotels and also the Chapel House sites and 2 transitional housing programs. Foster care numbers, we have right now 104 children in foster care, and those children come from 71 families that are in Cayuga County. We have 12 more cases that children are removed in their place with relatives. We have a large number of preventive services cases where we're trying to avoid foster care. That's another 67 cases. Caseloads are high, and we have caseworkers that are carrying more cases than I would like them to have, which is why, when I talk about critical need to fill, caseworkers are always ones that, we need.
What's your average number per cases what's your average cases per caseworker?
Right now in Child Protective, we have the caseworkers carrying between 30 and 40.
And we know the recommended, as I understand it, the recommended best practice is 15 to 18. Am I correct?
Yep, to have about 15 to 18. So we're far above that. We've pretty much always been like hovering above that. I mean, this is our caseload recovery now.
Mhm.
They really are. And that's attributed to vacancies, and also because we have had such a revolving door of caseworkers, we always have caseworkers in training. We always have workers that are being trained to be able to learn what they need to be assigned cases and work independently. And during that training time, that is pretty lengthy, they don't really have independent ability to take on a case assignment. So they work in partnership with the training team or with another worker. So that's really why the numbers are up for those other workers. I would love to see us get to a point where we don't have that sort of training loop where we always have a bunch in training, because what happens is, like it just recently happened, when we have workers that are seasoned that leave, the burden really falls on a small number. We just haven't been able to get out of this, I guess, pattern of what we're seeing with folks leaving for other jobs, leaving for other departments here, leaving for the state, the hospital, I mean, you name it. I've talked about it.
Sorry. In most cases, the resignations are not career retirements.
Right. Of the caseworkers. I can't remember the last time we had a
Actual career retirement. Okay.
that it's been a resignation. They've been resignations.
And would you happen to know by chance, we talked about the homeless, I know summertime's probably lesser, but what's your average length of stay? Do you know that for the families? 3 months, 2 months?
Our average length of stay,
Yeah,
but like 90 days.
90 days.
Yeah, it definitely does vary, and it varies depending on who we're talking about.
Time of year as well, right? I think your numbers go up in the winter time, go over
They
the,
do go up in the winter time. We're pretty high for the summer.
are you right now?
Mhm. Yeah, we haven't been able to get under, we haven't been able to get down like under 100 for the singles for quite some time, which is we didn't have that trend.
And one last question, then I'm done, I promise. Your cases per caseworker are between 30 and 40. Are you seeing an uptick in social services cases as a whole over year over year? Or have they stayed basically the same and or your staffing comes and goes, or what exactly as far as your total case numbers?
So I talked to the child protective supervisor today, actually, and I kind of asked a little bit like that kind of question. We average over a year, somewhere between 1,200, 1,300, 1,400 cases that come in from the state central register. So if you say 1,200, which is more than that, but that would be like 100 cases coming in per month that they have the period of time to investigate, that's like 60 days. So when they're coming in that fast and you have vacancies, maternity leaves, medical leaves, I mean, that's what's driving up those caseloads into 30 and 40. You know, a caseload of 40 for a child protective worker is extremely high, makes it very hard for them to get out in the field, do the work they need to do to meet the deadlines. You know, we're supposed to be making the determination of the outcome of the case within a 60-day period. And that in some cases involves a lot of interviewing, a lot of collateral interviews, a lot of home visits, setting up services. And so they're stretched very thin. And I remember the last meeting, I think it was the ledge meeting that I was at, one of the comments, I think it might have been you, legislator, that talked about burnout.
Yeah.
And about that being the kind of you can't really quantify that, but like the burnout of workers having to work so much additional time to try to just keep their head, above the water is huge factor, I think, in the services section, not only for child protective, but foster care, preventive as well. Very similar situations. The children that have come into foster care, there's just a lot of trauma, a lot of very complex issues that need to be worked on. Children that have been impacted by that have a lot of behavioral issues as a result. They're tough cases, and not easy situations to really plug a service into and expect that it's just gonna kind of fall out, that everything, starts to become better in a way that the child can go home quickly. So they're tough cases in services. And then the other section that has case workers is the protective area. And, I don't talk about that as much, but that is definitely as critical and as important as far as like the work that's done. We have those numbers in the adult protective services area over years has dramatically gone up because of the aging population increasing. And same kind of thing, COVID, people being isolated, mental health issues. We have a lot of cases in that area as well that need a lot of tending to. And not as much like resources out in the community for the contract programs to kind of assist. So the APS workers do a lot of the actual transporting and communicating and trying to find services for them. We have a lot more help in the children's services area. Thank goodness, because we need that. I'm not sure if that answered your question.
No, that's actually more info than I was looking for. So thank you. That's fine. Thank you.
A couple of other things about DSS that's happening right now that's just kind of just. We met with the records team about the Dreams project. We're coming into phase 3 of the Dreams project, and that phase is all DSS. So they said it'll take about a year for the records that DSS has in record storage to be turned into this microfiche system. So we're starting to have meetings with them about who our key people are, which records we're gonna have them send off by truck, I guess, to be turned into these digital images. So we worked on that today, like who's first, and then the staff from my department that are like these designated folks will begin to work on learning how to turn our new records into digital, so they don't have to ever go over to a box to record. So kind of exciting, also kind of daunting, honestly. We have about 3,000, well, they call them cubic something, but basically boxes. We have about 3,000 boxes that are stored in the records area that go back very far based on our record retention mandates.
which is crazy to think about, but all of the paper in those boxes will be turned into digital images and then will be destroyed on the schedule of when we can destroy them. And then also can be searched if we need to search for something in them, which will make it easier than having to go through a huge paper file. So seemed like it was very far off when we first started talking about the Dreams project, and here we are, we're starting.
Those records are accessible. They're not at the county office building.
Right.
Those paper.
They're
records.
stored already
Okay.
in the records department here at the county.
Phew.
I am working with staff in my services section on a new five-year child and family services plan. So they run in 5-year cycles. We're at the end of the cycle and starting to develop our plan based on looking at data, looking at services that we feel there's gaps. And what we're doing well, what kind of things we're really struggling with, and trying to come up with some goals around things we want to work on, helps us to kind of figure out and work with our preventive services contracts around what we need assistance with. We are going to be having a public hearing that we don't have a date set, but we will send out invitations. I'll send that to Heidi and she can, send that out. But if anybody's interested in coming to learn about our program areas like foster care, child protective, adult protective services, those are the ones we really focus on and have to focus on by the state. They tell us what we need to really talk about at a public hearing, but we'll talk about some other things as well. Really gives us an opportunity to talk about and highlight some of the good work we're doing, and also gives us an opportunity to talk about what we're struggling with and get feedback from stakeholders. We'll invite stakeholders that we work with and also invite members of the public to come in as well to hear and also give us their opinion. And then that feedback that we get, we can incorporate, I have to write it all out, put it in the plan. And can, incorporate that or change things based on the information that we receive at that public hearing. So that will be happening. I think it's probably going to be in the month of September that we have to publish it in the paper, online, and then also in the actual newspaper.
Are you spearheading the writing of the 5-year plan yourself or sort of?
I am not.
Okay.
For the first time ever in my career, as in my higher positions as in leadership, I am not. So the directors of services that we have, and the supervisory staff and services are really the ones that take the lead.
Mm-hmm.
They've never done a 5-year plan, so I anticipate that I'll be heavily involved in guiding them and pointing them in the right direction, but I am not going to do the whole thing. That's a win.
Good.
The other thing I just wanted to mention is that we, out of the blue and unbeknownst to me, the state has implemented a family-centered case management service program with an allocation that was given to us, $330,000. And the purpose of that is to help us work with identified families that receive TANF who are struggling with getting off of those services, those benefits, and have some barriers that seem to be like in the way of them maybe being able to be more independent. Substance use, mental health disorders, domestic violence. We can target like certain populations of folks, and even target homeless folks. So we are in the beginning stages of having conversations about what that should look like how are we going to utilize that allocation and who would we want to partner with and contract with to deliver the services. It's supposed to be a very intensive case management program and looking at clinicians to be the providers of the service if possible because of the level of need and the issues that these folks are needing to address. So exciting, more to come on that. Something totally new, totally brand new.
Good news. So find room for them, or maybe contracted service.
Yeah, we gotta come up with a plan. Anybody have any other questions for me? Thank you.
Thank you, Christy. Thank you very much. Motion to adjourn.
Move it.
All in favor?